Calling the 1 p.m. calendar for Health and Human Services. Present with me is Senator Hashimoto. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, the 19th, at 1 p.m. in room 225. For those on Zoom, your audio will be muted, video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. Excuse me. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you that committee does have your testimony. I have reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. Oh, we have quorum. So for, because we have quorum, we are going to go directly to the deferred calendar of HB 1194. Oh, we have vice chair ready. Oh, terrific. We have almost entire complement. So we're going to go directly to DM of HB 1194, which was from Friday. Chair's recommendation is to pass with amendments. We are going to add a new paragraph to Section 8 under exemptions to add an A, a person invited by the patient to attend the birth occurring at a location other than at an accredited birth facility where no compensation for the attendance or service is contemplated, charged, or received. We're also going to remove the phrase before January 1, 2020 from the last sentence in Section 9. And I note for those who are listening in, this should allow for the PEP process under the NARM standards. We're also going to allow, accept the Department of Health's proposed amendments. Any comments, questions, or concerns? Seeing none, Vice Chair, for the vote pass with amendments HB 1194.
Okay, recommendation of the chair is to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keokolole.
Aye.
Senator Favela.
Aye.
Recommendation is adopted, Chair.
Okay, thank you very much. And with that, we'll go. Can we go directly to the other 1 p.m. calendar?
Yes, you can, Chair.
Okay, thank you very much. So for HB 139 relating to insurance, first up we have Department of Attorney General providing comments.
Good afternoon, Chair, Vice Chair, members of the committee. Andrew Kim, Deputy Attorney General. We provided written comments regarding a possible unlawful delegation of legislative power, and we've provided some suggestions on how we can get around that. And then also language clarifying that health maintenance organizations would provide coverage after a certain date, and then also possible defrayment. Thank you. I'll be available for questions.
Thank you very much. Next is Insurance Division of DCCA providing comments.
Good afternoon, Chair, Vice Chair, members of the committee. Jerry Bump, Acting Insurance Commissioner, will stand on our written testimony providing comments. Thank you.
Thank you very much. Next, we have Office of the Auditor providing comments. Next, we have John Termitsu Kaiser Permanente providing comments. John, please proceed. You have 1 minute.
Thank you, Chair, Vice Chair, and committee members. John Termitsu for Kaiser. Kaiser stands on his testimony requesting an amendment. Thank you.
Get this for me. Okay, next we have HMSA in support. Thank you very much. Next, we have Hawaii Association of Health Plans in support.
Thank you, Chair. We'll send another testimony in support.
Thank you very much. Next, we have Hawaii Society of Clinical Oncology in support, American Cancer Society Cancer Action Network in support, Fertility Institute of Hawaii in support, Tiara Brown in support, Annette Carmon in support, Adam Zarin, Leukemia and Lymphoma Society in support, Joyce Reneke, Alliance for Fertility Preservation in support. Anybody else wishing to testify on HB 139? Members, any questions? Okay, seeing none, moving on. For HB 1379, relating to health. First up, we have Dr. Lewin, State Health Planning and Developmental Agency in support. Dr. Lewin.
Madam Chair, we'll stand on our written testimony. It's a complicated bill, but.
Stand in support.
Thank you.
Thank you very much. Next, we have Hawaii Medical Board in support. Chelsea Fukunaga, are you present? In support, thank you. Michael Robinson, Hawaii Pacific Health in support.
Yes,
Mr.
in
Robinson,
support.
please proceed.
We stand our written testimony in support. Thank you.
Thank you very much. Next, Chamber of Commerce of Hawaii in support. Grassroots Institute of Hawaii in support. Philippine Medical Association of Hawaii in support. Hawaii Medical Association, Dr. Ignacio in support. M. Chong in support. Dara Yatsushiro in support. Dr. Guy Yatsushiro in support. Anybody else wishing to testify on HB 1379? Members, any questions? Next up, we have HB 613 relating to homeless youth. First up, Director Yamane, Department of Human Services in support. DHS? No? Okay, moving on. Leanne Gillespie, Department of Human Services, OIS, Office of Youth Services in support.
We stand in our written testimony in support. Thank you, Chair.
Thank you. Hawaii State Department of Health in support. Behavioral Health Administration, Office of the Public Defender in support. Nahealani Parsons, Hawaii State Association of Counties in support. Nahealani. Okay, moving on. County of Hawaii, Office of Housing Development and Community Development in support. County of Hawaii, Office of the Mayor in support. Jen Kagiwara in support. Hawaii County Council, District 1, Heather Kimball in support. Pride at Work Hawaii in support. Mr. Galoyo, you present on Zoom?
Yes, I am, Chair.
Okay, please proceed. You have 1 minute.
Michael Galoyu, President, Pride Work Hawaii, he, him pronouns. This bill is so needed. As we just saw last month, Hawaii County issued their report to address homelessness in their county, and it failed to even mention homeless unaccompanied minors. If we're going to make a dent in, let alone end homelessness in Aloha State, we need to start addressing the needs of the homeless unaccompanied minors. We have a couple of questions we hope that you will ask the Office of Youth Services. What percentage of these funds, if approved, will be directed to low barrier shelter servicing homeless unaccompanied minors under the age of 18? As of today, how many low barrier or not youth shelters are there in the state of Hawaii for homeless unaccompanied minors under the age of 18, and how many beds does that number represent? So we do support the bill. We would like clarity on this as it moves forward. Mahalo.
Okay, thank you very much. Next we have Judith Clark, Hawaii Youth Services Network in support.
Aloha Chair, members of the committee. I'm Judith Clark, Executive Director of Hawaii Youth Services Network. I don't need to tell you how much homeless people need these services, but I do want to point out that we have spent over 2 years in the pilot project planning and beginning to implement some very innovative and important services for homeless youth. And without funding from this bill, that 2.5 years of effort will be lost. Thank you for this opportunity to testify.
Okay, thank you very much. Next, we have Stonewall Caucus of Democratic Party of Hawaii, Abby Simmons. On Zoom, please proceed.
Aloha Chair, Vice Chair, mahalo for the opportunity to testify. We stand in strong support on our written testimony. Mahalo.
Okay, thank you very much. Sarah Simmons, Democratic Party of Hawaii in support. Hawaii State LGBTQ Plus Commission. Rick Velasquez in support. Are you present, Rick?
Yes.
Please proceed.
We stand in strong support, stand on our testimony. This is very important to help the youth of Hawaii. Thank you.
Okay, thank you very much. Next, we have Alan Johnson, HSAC, Hawaii Substance Abuse Coalition in support. Going Home Hawaii, Lester Estrella in support. Hawaii Health and Harm Reduction Center, Nicholas Leverance in support. Nicholas, are you present?
Not present on Zoom, Chair.
Okay, thank you. Geraldine Marcus, Pacific Academy of Music in support. Master Shelby Pikachu, billionaire of Ohana Unity Party and Kingdom of the Hawaiian Islands in support. Master Shelby, are you present on Zoom?
Not present on Zoom, Chair.
Okay, Melissa Pavlicek, Opportunity for Youth Action Hawaii in support. Michael Galoyu Sr. in support. Thaddeus Pham in support. Joe Wilson support. Michael Older in support. Jesse Gonzalez in support, Tasman Maddox in support. Anybody else wishing to testify on HB 613? Okay, come on up.
Good afternoon, Chair, Vice Chair. My name is Sarah. I'm a Master of Social Work student. I strongly support HB 613 to make safe spaces for youth permanent. And over the past 3 years, I've worked with youth in Nanakuli as well as interning at DHS with helping children and families while also volunteering with several organizations. Safe spaces for youth can be a refuge, a place where young people can take a moment to breathe, process what they're going through, or even just have a meal for the night. Sometimes all they need is a pause. The state must recognize this and take action. I urge this committee to invest in our youth. Thank you.
Thank you very much. Okay, anybody else wishing to testify on HB 613? Members, any questions? Okay, seeing none, moving on. HB 701 relating to taxation. First up, we have Kirby Shaw of DCAB, Disability Communications Action Board, Access Board in support. Kirby Shaw, you present on Zoom.
Not present on Zoom, Chair.
Carolyn Kadirao, Executive Office on Aging, providing comments.
Yes, Senator, we'll send on our written testimony.
Thank you very much. Department of Taxation, providing comments.
Aloha, Chair, Vice Chair Harrison for Tax. We'll stand on our written comments.
Thank you very much. Gary Simon, Policy Advisory Board for Elder Affairs, PABEA, in support. Tom Yamachika, Tax Foundation of Hawaii, providing comments. Tom Yamachika, you present. Please proceed.
I am present. Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation of Hawaii. We are concerned because the bill has blanks in key areas. So we think those should be filled in so a proper revenue estimate can be generated. And then we have some idea of what kind of a credit we're dealing with. We're also concerned because if the contemplated credit is very small, there is going to be a large amount of overhead expense attendant to form changes, reprogramming, and so forth. And we wanted to make sure that that is a cost-effective use of our state workers' time. We have to answer any questions. Thank you very much for the opportunity.
Okay, thank you very much. Next, we have Kelly Lopez, ARP of Hawaii, in support. Come on up, Audrey.
Audrey Suga Nakagawa, Advocacy Director for ARP Hawaii. I'm here on behalf of the State Director, Kelly Lopez. ARP stands in very strong support of this measure. We really appreciate having this bill heard by this committee. This tax relief would really, tax credit relief will help many of our family caregivers who are really trying to take care of their loved ones. And we know that the cost of care is very expensive and can add up to the average is about $7,200 a year. So having this small relief would provide a tremendous help for these families who can continue to care for their loved ones at home. Just want to let you know that ARP has been working with the tax office and the Executive Office on Aging on how to process the verification of the expenses. So should this bill pass, we'll be working with them to work out the logistics. So thank you very much.
Thank you very much. Nicole Wu, Hawaii Children's Action Network, speaks in support. Nicole, are you present? Please proceed.
Yes, thank you, Chair, Vice Chair, members of the committee. I'm, as you said, with Hawaii Children's Action Network. Many of the parents that we work with are in the sandwich generation, so they're caregiving for parents, for their own parents and their children. They're definitely getting squeezed by these costs, which is why we support this bill. Thank you.
Thank you very much. Kobe Chalk, Alzheimer's Association Hawaii, in support. Bronson Silva, Democratic Party of Hawaii, in support. Rachel Lewis, Easter Hills Hawaii, in support. Diana Espinas, in support. Catherine Bukovets, in support. Esther Ueda, in support. Naia Newlight, in support. And 7 other individuals, all in support. Anybody else wishing to testify on HB 701? Ma'am, come on up.
Thank you. Chair San Buenaventura, Vice Chair, and Senator Kale Coley. We're in strong support of this. The Kapuna Advisory Council really wanted to get behind this for SHPTA, and also part of the Kapuna caucus here in the legislature. We think this is an important measure in terms of helping families, and particularly for kupuna who are lacking services. So thank you very much.
Thank you very much. Anybody else wishing to testify on HB 701? Members, any questions? I do. AARP, any other state passed this?
Yes, Oklahoma has passed this.
Okay, I noticed like what Tom Yamachika pointed out, there are a bunch of blanks in the bills.
In terms of
How much?
how much?
credit
Well, it's
and-
5,000. It was at 5,000, and so the previous committee must have blanked that out, and so,
So it's your request that it be 5,000?
yes, it's non-refundable.
Non-refundable, okay, thank you
Yes.
very much. Okay, Department of Taxation. Did you do it didn't look like you did, any kind of fiscal impact on a $5,000 non-refundable credit?
No, there was on that one. It was just under 400 million.
400 million.
Let me make sure. Yeah, 397.4 loss to expected revenue to the general fund. And that was at the 5,000 and 100% reimbursement.
Okay, because I didn't see that here, so it must have been in another committee hearing.
Yeah, I think they took it out just because they blanked out the bill for this one, so they didn't, but that
Okay,
was the
but if
prior
we put in
estimate.
the 5,000, we're talking about less than well, that's still a lot of money.
Yeah.
$400 million in fiscal. Thank you very much.
Thank you.
Anybody else wishing to testify on HB 701? Any other questions? Okay, seeing none, moving on. HB 716 relating to health. First up, we have Department of Health in support.
The department stands on its written testimonies.
Thank you very much. Dr. Lewin from SHPTA in support.
Madam Chair, Vice Chair, members, I'd just like to make a couple comments on this. The price tag is pretty big, $20 million or $25 million between that, in that range. But we are a state with 80% of our delivery system having chosen one electronic health record, which facilitates a lot of quality of care and care coordination. But the rural clinics, many of the neighbor island facilities don't have this service. They can't afford it. So this would be a one-time expenditure to get everybody connected in the state. It would be a tremendous achievement. It would improve quality of care, it would save money, and it looks like a big price tag, but it's a one-time spend to get everybody up and running in care coordination. It'd be an amazing achievement for the state. And other states have multiple electronic health records. We have relied on one for 80%, Epic, actually. I'm not a salesperson for Epic, but having everybody connected would be fantastic. And so we'd like to see this happen as a one-time. I just would add that the organizations who receive this service would be able to maintain their service after the original investment was made to get it up and running. Thank you very much.
Okay, thank you very much. Next, we have O-Chin in support. Jennifer Stoll, are you present on Zoom? Please proceed.
I am, Chair. And thank you, Chair, and members of the committee. Jennifer Stoll, for the record, External Affairs President for O-Chin. We stand on the written testimony submitted in strong support and reflect the comments by Dr. Lewin. Just a couple of additional points. Passing this bill will allow for those that have been left behind technologically to have the infrastructure they need to really respond to future healthcare crises, improve healthcare delivery, and leverage new technologies to really innovate for population health. For these reasons, we ask for your support, available to answer any questions, and mahalo for the opportunity for testimony.
Okay, thank you very much. Next, we have Paige Waikiki Health in providing comments. Paige Choi Healthcare Association of Hawaii in support. Ian Ross, Waianae Coast Comprehensive Health Center. Ian, are you present on Zoom in support?
Not present on Zoom, Chair.
Eric Abe, Hawaii Primary Care Association in support. Nicholas Levens, Hawaii Health and Harm Reduction Center in support. Elizabeth Ignacio, Dr. Ignacio of Hawaii Medical Association support. Michael Robinson, Hawaii Pacific Health in support. Anybody else wishing to testify on HB 716? Members, any questions? Okay, I have a question. O-Chin, are you still present? Jennifer Stoll.
I am, Madam Chair.
Okay, how much is this going to cost the state?
The fiscal note, it would create a grant program, and once the money's out, the money's out. The providers will get to select whatever system that they want, but once the program has been administered by the state, the providers that have selected being able to participate, it's a one-time investment.
Okay, so you don't know. Okay, Dr. Lewin, come on up. You testified 20 to 25 million, but it is a grant program, so it's first come, first serve. Is that what you're planning on doing?
We think every one of the providers would be willing to step up and move in this direction if we had this grant program. There are going to be some variation in costs in terms of getting the staff trained and up to speed and so forth. So the best estimation we have is between 20 and 25 million. We would not want to see more money spent than is needed, but the fact is it's going to cost at least 20 million to get all the rural health providers in, the community, the critical access hospitals, and some of the clinics like the Ryan White programs and others that just can't afford this kind of service. It's a lot of money. It's a one-time expenditure.
Okay, but like the Ochins testified, if the money runs out, the money runs out. So it's going to be a first come, first serve of which provider wants to have it.
There will be some people that would be left out of this program. They would be the
Sounds
onesie, twosie physician practices in communities that may not step forward. But in those cases, we can connect them to the system with less expensive approaches. The Ochin folks are interesting in that they can bring a lower cost Epic product to market that we're not unable to purchase here at the present time.
Have you thought about like a matching amount of money for the big providers if they want to be part of this?
We certainly would be open to that because it might extend to some of the onesie twosie practices if we could go that far with it. So that would be, yeah. And many people have already invested, including a few of the federally qualified health centers and a few of the critical access hospitals, but most have not.
Okay, thank you very much. Any other questions? Okay, moving on. HB 799 relating to healthcare. First up, we have Dr. Lewin, State Health Planning and Development Agency in support.
I will stand on my testimony. It's a complicated bill. Happy to be here for comments or questions.
Department of Health in support.
The department will stand in support, emphasizing our amendments that request a study be conducted to determine the efficacy of this public policy.
Okay, thank you very much. Derek Mizuno, EU2F, providing comments. Maui Health Systems in opposition. Lynn Fulton, please proceed.
Good afternoon, Chair, Vice Chair, and members of the committee. I just want to highlight my concern over the long-term impact this could have on the island of Maui, and especially the physicians that are dedicated to Maui and that would be responsible for caring for any negative outcome that could happen as a result of this. Besides that, I stand on my testimony. Thank you.
Okay, thank you very much. Next, we have Paige Choi, a Healthcare Association of Hawaii, providing comments. Next, we have United Healthcare in support. Okay, next we have Tasman Mattox in support. Dr. Ignacio, Hawaii Medical Association in support. Community First Hawaii in support. And I thought I saw Kaiser. Did you have a position on this? No. Oh, okay, sounds good. Okay, members, any?
Maybe HMSA.
Okay, HMSA, come on up.
Thanks, John Ching.
Aloha, Chair. Oh, I'm sorry.
We're friends here.
I'm sorry, I thought I called you, sorry.
No worries. Thank you, Chair, Vice Chair, members of the committee, Don Carisi on behalf of HMSA. We just want to thank you for hearing this important measure, and HMSA strongly supports efforts to increase access and strengthen our healthcare workforce. And we understand that while this is not a silver bullet to fixing any healthcare workforce shortage, it is a necessary update that will align our state's practices with current CMS regulations, which were already updated in 2019, that removes barriers for physicians who wish to travel to the neighbor islands to provide critical care. I also want to point out that while this policy change would be applicable and could be beneficial statewide, it is truly notable on Maui, where the community has faced numerous challenges, including a shortage of specialty care and an increasing need for services, especially due to the impacts of the wildfires. Also, where the healthcare system is uniquely set up and sometimes can create additional barriers to accessing care. I also want to note that we'd be supportive of DOH's suggested amendments of an evaluation a year after implementation, and just want to say that we strongly support efforts to increase access on our neighbor islands, especially in rural communities. So thank you for the opportunity to testify.
Thank you very much, and I apologize. Rachel Wilkinson, Hawaii Health Association of Health Plans, providing comments. Okay. Anybody else wishing to testify on HB 799? And I'd also like to point out Community First Hawaii, Randy Kurohara in support. Anybody else wishing to testify on HB 799? Members, any questions? Department of Health, I have a question. Okay, I have similar concerns like Maui Health, and that's why it surprised me that Kaiser, who's the hospital in Maui, doesn't have a position on this. My concern is that by allowing physicians to not have hospital privileges, the hospitals will have a shortage of on-call physicians. And I just likened it to my experience in the 90s on the Big Island, when all the psychiatrists on the Big Island chose not to have hospital privileges. And so when there was an emergency, a psychiatric episode, they had difficulty containing such an episode.
Right.
Do you share the same concern?
Well, certainly the administrative rules that this measure seeks to supersede had that in mind, where we wanted a more equitable distribution of physicians and healthcare providers. So that was the original intent. That said, some of the benefits are intuitively obvious in just flying people over. But so we think a report that studies the benefits and impacts to patient safety, to access, to negative outcomes is a prudent way to measure the success or to see how this public policy works.
I'm thinking of actually a sunset date and requiring a report prior to the sunset date to remove the sunset date. Because my concern is as soon as you lessen the on-call physicians, it becomes an avalanche. That why should we have hospital privileges? Because then in the middle of the night, while we're in the middle of it, in the middle of something, we get called on more often because less physicians are going to be on call. So do you have a position? I'm thinking about a 3 or 5 year sunset date.
The department wouldn't object to that. It's really the report that we're interested in. We need, public policy and healthcare policy should be data driven. So we need to see what the outcomes of this is going to be. So whether it's a sunset date or we revisit it after the report is published, or we get maybe several years worth of data and seek to amend or repeal this, we're open, but that decision needs to be data driven. And so the report is what we're at.
And I think that's what basically the reason why the Maui physicians, I see their continuing hospital, Maui Health System, Kaiser Permanente is against this, is because of that potential.
That's an understandable concern.
Okay.
And like you said, you lived through it, on the Big Island, so it's unintended consequence. So again, as long as we're making sound public policy based on data and revisiting it, that's what the department is supporting.
Okay, that sounds good. Dr. Lewin, I see you nodding your head. Do you have any other comments to make?
Well, I think, thank you for that.
And basically, my proposed amendment is to have a sunset date where the report is going to trigger the potential of removing that sunset
I
date.
would strongly support that. In general, we don't want physicians outside of accepting hospital privileges. It also could take all the specialists out of the hospital. It would undermine the services for lower income people. So we don't want that, but right now there is such a shortage of specialists that this is a short-term thing. But I think that sunset makes great sense.
Okay, thank you very much. Any other questions regarding 799? Seeing none, moving on. Okay, next up, HB 1179. 1179. Relating to rural emergency hospitals. First up, Director Yamane, Department of Human Services, providing comments. Okay, Judy Moore Peterson, please proceed.
Thank you. Aloha, Chair, members of the committee. Judy Moore Peterson, MedQuest Administrator. We stand on our written comments, our written testimony, offering comments. We appreciate the intent of the measure, just pointing out that we need to have continued conversation. Thank you.
Okay, thank you very much. Next, Department of Health in support.
Aloha, Chair, Vice Chair, members of the committee. Lauren Kim, Planning and Policy Officer for DOH. The department supports Bill Section 2, which authorizes the department to issue the license for rural emergency hospital. But we need amendments technical friendly amendments that are required should this bill pass, that we can actually implement this. As written, it basically reads that whenever an entity decides to do this, that we shall issue the license. But it's a little more than that. We have to inspect the facility and we have to make a recommendation to CMS. And so our amendments reflect that. Also, we do not need rulemaking authority since this is a Medicaid CMS program that is governed very strictly by rules. We are delegated authority from CMS to conduct these inspections and to regulate these entities. So rulemaking is not necessary. And that's similar to the critical access hospitals. Again, another CMS program for which the Department of Health does not have rulemaking authority. So it's unnecessary.
Okay, thank you very much. Next, we have Lynn Fulton, Maui Health Systems in support. Lynn Fulton, are you present on Zoom? Please proceed.
I am. Thank you, Chair, Vice Chair, members of the committee. I just want to really stress my support for this bill and what it could mean to bring additional federal funds into the island of Lanai, allowing us to operate that as a rural emergency ED and be able to switch 2 of those beds over to long-term care where we have a long wait time to get into the long-term care beds, while also increasing our reimbursement to better fund healthcare on that island. Thank you.
Okay, thank you very much. Next, we have Edward Chu, Hawaii Health Systems Corporation in support. Paige Choi, Healthcare Association of Hawaii in support. Anybody else wishing to testify in HB 1179? Members, any questions? Judy Peterson, are you still present? Judy?
Yes, I'm present.
I have a question.
Yep.
So my concern is whether or not this constitutes Medicaid expansion. I personally don't think so because we're not extending the insureds, right? We're just allowing more healthcare providers to service the insured. That interpretation correct?
That is correct. It is not considered a Medicaid expansion. It is merely creating a new type of provider.
Okay, thank you very much.
You're welcome.
Okay, any other questions on HB 1179? Members, okay. Moving on, HB 951 relating to prescription drugs. First up, DCAB, Kirby Shaw in support. Kirby, are you present on Zoom?
Not present on Zoom, Chair.
Jared Verdula, I see you present. Department of Law Enforcement in support.
Good afternoon. The department will stand on this testimony.
Thank you very much. Jonathan Ching, Kaiser Permanente in support.
We'll stand on our testimony in support. Thank you, Chair.
Okay, anybody else wishing to testify on HB 951? Members, any questions? Seeing none, moving on. HB 1120 relating to nuisances. First up, Department of Health, Environmental Health Administration in support.
Thank you, Chair. We will stand on our written testimony.
Okay, thank you very much. Ted Boland, Hawaii Reef and Ocean Coalition Climate Protectors Hawaii in support. Nicholas Zare in opposition. C. Koi Lucas in support. Abra Green, Libertarian Party of Hawaii in opposition. Anybody else? Testifying HB 1120. Members, any questions? Okay, I have a question for Department of Health. Come on up. Okay, Ted Boland suggests, and basically I did something similar with the Senate version, basically removing the et al. And just making it more general. That would you have, so long as it refers to public health and environmental health. So basically removing such as foul or noxious odors, gases or vapors, and all basically it just becomes all nuisances and all causes of sickness or disease which may be known to them or brought to their attention that in their opinion is dangerous and injurious to public health or environmental health. Do you have any problems with removing that such as clause?
Background on the Department of Health, Environmental Health Services. No, we don't. I think that the changes made the first time around on your side was accurate. We just want to really ensure that the standard is public and environmental health, and that we have the ability to act, especially as the threats have brought into against kind of everything, and that we need to coordinate more with other agencies.
Okay, thank you very much.
Thank you.
Okay, any other questions relating to nuisances? Okay, moving on. Next up, we have HB 952 relating to Parkinson's disease and research. First up, Department of Health providing comments.
Hello, Lauren Kim again on behalf of Director of Health Kenny Fink. We submitted comments requesting an amendment to put an appropriation amount. This is, we think that this will add value, but this is essentially creating a nascent version of the UH Cancer Center. It's a heavy lift, and we can't do it for free. There is no home for this currently in the Department of Health. So if the committee report could reflect, we have an estimated amount and a number of FTE, as well as an amendment that's a blank appropriation, that would be appropriate. Otherwise, we would have to oppose this very well-meaning, well-intentioned bill.
Okay, thank you very much. Next up, Hawaii Parkinson Association and support, Glenn Higa.
Thank you, Vice Chair. Chair, Vice Chair, members of the committee, my name is Glenn Higa, President of the Hawaii Parkinson Association. Stand on our written testimony in support of this bill. One of my goals as president is to ensure that no one living with Parkinson's faces this condition alone or in isolation. Living with Parkinson's can be lonely and isolating, and I faced this scenario when I was first diagnosed with young onset Parkinson's disease 7 years ago. Since then, I've become involved with HPA, made a lot of friends who also suffer from this condition, been elected president, and became a community leader here in Hawaii, and established contacts throughout the country. I'm fortunate to have had this opportunity while others are unfortunately suffering in silence and loneliness. A database that identifies who these people are and where they live is a necessary step to overcome this issue. By identifying where the incidences and prevalence of Parkinson's occurs, we can direct appropriate resources and programs to meet the needs of these neighborhoods. In 2019, the Michael J. Fox Foundation estimated the direct and indirect costs of treating and coping with Parkinson's.
Thank you very much.
Thank you.
Next, we have Dr. Michiko Bruno, Queens Health Systems in support. Dr. Bruno, are you present on Zoom? Oh, you're present.
Thank you. Hi, good afternoon, Chair, Vice Chair, members of the committee. Thank you so much for this opportunity to testify. Yes, my name is Michiko Bruno. I'm a neurologist, movement specialist, and I'm also a professor of medicine at John A. Burns School of Medicine at University of Hawaii. I've been treating Parkinson for over 20 years. It's a very complex disease. Queens support this bill strongly. It aligns with our mission to provide equity to everybody in Hawaii. I think we've heard a lot of discussion throughout this hearing about rural health and providing equity as a goal. So I think having data, also we heard about having data is essential. So we really support this. Yeah, thank you so much.
Okay, thank you very much. Gary Simon, Hawaii Family Caregiver Coalition in support. Amy Kelly, Brain Matters LLC in support. Zach Hardy, Michael J. Fox Foundation for Parkinson's Research in support. Zach Hardy, please proceed.
Good afternoon, Chair, Vice Chair, members of the committee. I appreciate the opportunity and stand by my written comments that have been submitted to the committee. I would just like to highlight, and going off of what Glenn was saying in his testimony, that to our best estimates, over 90,000 people are diagnosed with Parkinson's each year in the United States. Currently, the direct and indirect costs of care for the more than 5,000 people living in Hawaii with Parkinson's, we believe to be around $250 million per year. We also believe the numbers of prevalence and incidence, as well as that economic burden, may be undercounts. So just really highlighting the importance of this, what this registry can do for the research community, and would like to highlight the momentum we've seen in other states. Hawaii has the opportunity to become the 16th state to create a registry, as Kentucky just passed their bill on Friday, becoming the 15th state. So we urge members of the committee to support this important bill. Thank you for the opportunity.
Okay, thank you very much. Next, we have Drew Higashihara, Hawaii Parkinson Association, in support. Sherry Higashihara, Hawaii Parkinson Association, in support. Leela Moore, in support. George Ross, support. John Kojima, in support. Marshall Moore, in support. A. Kawasaki, in support. Phyllis Aguiar, all in support. Anybody else wishing to testify on HB 952? Members, any questions? I have a question of Jack, since you're here. I hate to do this to you. Come on up. And I know you didn't register. So you heard Department of Health. It requires, I'm thinking because this is just a database that they want. Do you have any opposition if instead of Department of Health, they give it to you with an appropriation of language allowing you to contract? Because I also agree with Department of Health that it should be done by DOH.
We'd be happy to do that if we had the resources to do it. We think it is necessary.
Thank you very much. Okay, members, any questions? Seeing none, moving on. HB 1099, emergency appropriation to Department of Human Services. First up, Director Yamane. Thank you. Betty Lou Larson, Catholic Charities Hawaii, in support. Are you present, Betty Lou?
Yes, Catholic Charities will stand on our written testimony in strong support. Thank you.
Thank you. Marilyn Yamamoto, Hawaii Coalition for Child Protective Reform, providing comments. Meredith Welch, Hawaii Food and Policy, in support. Nicole Wu, Hawaii Children's Action Network, speaks in support. Nicole, are you present? Please proceed.
Yes, I am. Thank you, Chair, Vice Chair, members of the committee. More than half of SNAP recipients in Hawaii are families of children. It helps tens of thousands of children go above the poverty line, and we know how much groceries cost. This bill is a great way for us to reinvest in our systems and make sure that we have a more accurate and efficient program. So we support this bill. Thank you.
Thank you very much. Next, we have Hunter Hiavilin, Hawaii Farmers Union, in support. Anybody else wishing to testify on HB 1099? Come on up.
Aloha Chair, Nate Hicks with Hawaii Public Health Institute, in support. This is a no-brainer. We can either give it to the feds or invest it here. In addition, I think it's very important that we recognize this is just a start to making sure our SNAP program is robust. This $5.5 million won't fix everything. We need to make sure we're putting money to make sure the SNAP program is efficient for everybody. Mahalo.
Thank you very much. Anybody else wishing to testify on HB 1099? Members, any questions? Seeing none, moving on. HB 943, relating to homelessness. First up, Hawaii State Department of Health, in support. Department of Health. Okay.
Not present on Zoom, Chair.
Jack Lewins, if Shipta, in support.
Strong support. Stand on our testimony.
Thank you. Mike Lambert, Department of Law Enforcement, in support. Okay. Haley Chang, Office of the Public Defender, in support. Hawaii State Council Mental Health, in support. Kate Tashima, Housing Administration for Kehaulani Costa, of County of Hawaii Office of Housing and Community Development, in support. Alan Johnson, HSAC, Hawaii Substance Abuse Coalition, in providing comments. Waikiki Health, providing comments. Nicholas Levens, Hawaii Health and Harm Reduction Center, in support. Jillian Anderson, Waikiki Neighborhood Board, in support. Tim Hansen of NAMI, Hawaii, in support. Master Shelby Pikachu, billionaire of Wahana Unity Party and Kingdom of the Hawaiian Islands, in support. Master Shelby, are you present on Zoom?
Not present on Zoom, Chair, but actually we have Department of Health present on Zoom.
Okay, Department of Health, proceed. Department of Health, can you turn on your video and turn on your microphone? Okay, please proceed.
Good afternoon, Chair and members of the committee. Robin Loudermilk with the Hawaii State Department of Health. The Department of Health supports this measure. Good afternoon, Chair and members of the committee. I'm Robin Loudermilk with the Hawaii State Department of Health.
We can hear you. You've identified yourself twice. Please proceed. We have your written testimony.
Okay, yeah, we stand by our written testimony. Thank you for the opportunity.
Okay, thank you very much. Next, we have Jillian Anderson, Waikiki Neighborhood Board, in support. Tim Hansen of NAMI, Hawaii, in support. Oh, I think I read all that. Alex Slickton, Hawaii Psychological Association, in support. Connie Mitchell, Institute of Human Services, in support. Mapuanani Hardy Kahaleomi, in support. Mapua Mapuana, are you present? Please come on up.
Velinamai and Alala Komike. My name is Mapuana Hardikahale Umi, and I am a social work student at the University of Hawaii, as well as a former intern at Ho'okahileo Kauhale on Middle Street. I'm testifying in support of HB 943 with amendments. During my time at the Kauhale, which is a low barrier tiny home shelter program, I was able to work directly with many community members who were being affected by co-occurring disorders. Folks had shared that simultaneously having to navigate a variety of mental health as well as physical health conditions, while also having also struggling with substance use disorder, heavily impacted their experiences with chronic homelessness. And I also had the privilege of listening to their stories, their life stories, and they consistently shared that there were many barriers when it came to accessing triage as well as treatment services.
Okay, please wrap up.
Oh, mahalo. So I just wanted to say with these amendments as well that I was considering, it is, I believe it's effective July 1st through the year 3000. So if you could please go ahead and amend that sooner, I really appreciate it. Mahalo.
Next, we have Kekua Wela Tauala in support, Chelsea Huntington in support, Denise Boisberg in support, Ellen Godby Carson in support, Michael Alder in support, Jim Jorgensen in support, Tasman Mattox in support, Landis Lum in support. Anybody else wishing to testify on HB 943? Members, any questions? Seeing none, moving on. HB 359 relating to covered offender registration. First up, we have, Department of Attorney General in support.
Good afternoon, Chair, Vice Chair, members of the committee, Deputy Attorney General Elise Oyama for the department. The department stands in support of this measure. Just to provide background, when offenders are convicted for these types of for these types of offenses, they right now would not have to register with the state. This is not only Hawaii sex offenders, but it also would be for mainland offenders. So if they come into our state, they wouldn't have to register. So this bill makes necessary updates to these offenses. Thank you.
Okay, thank you very much. Pamela Ferguson Bray, Crime Victim Compensation, State of Hawaii in support. Taryn Tomosa, Office of the Public Defender in opposition. Lasman Chain, Hawaii State Commission on the Status of Women in support. Carlene Lau, Hawaii Police Department in support. Carlene Lau, you present. Please proceed.
Hi, good afternoon, Chair, Vice Chair, and members of the committee. I'm Carlene Dow, Major of the Records and Identification Division of the Home Police Department. We stand on our written testimony in support of this bill. Thank you.
Okay, thank you very much. Next, we have Lynn Costello Matsuoka, Sex Abuse Treatment Center in support. Lynn, are you present?
Yes, we stand on our written testimony in support of the bill.
Thank you very much. Anybody else wishing to testify on HB 359? Members, any questions? Okay, come on up.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Daniel Hugo for the Honolulu Prosecutor's Office, and I'm testifying in support of this bill. The sex offender registry is important. It's an important response to these secretive, ruthless, and predatory crimes. And offenders who exploit their professional status in order to access minors are among the most dangerous of these criminals. This bill would add them to the covered offender registration list. I also did review with interest the public defender's claim that this bill is too harsh because the male brain continues to develop up until the age of 30. As one of the owner-operators of this male brain, I can confidently say that a man of 21 years old, society should expect that he can conduct himself decently around minors. And the public should be warned if he cannot. Thank you.
Thank you very much. Okay. Anybody else wishing to testify on HB 359? Members, any questions? Members, are you ready to proceed with decision making? Okay, do we have all of the vote sheets here? Okay, so for HB 139, Chair's recommendation is to pass with amendments. We're going to accept the Attorney General's proposed amendments And we're also going to amend, add a different defective date of December 31, 2050. Any comments, questions, concerns? Seeing none, pass with amendments. Chair votes aye. Vice Chair for the vote.
Okay, House Bill 139, House Draft 2, recommendation of the chair is to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keokolole.
Aye.
Senator Favela.
Aye.
Recommendation is adopted, Chair.
Okay, thank you very much. For HB 1379 HD2, Chair's recommendation is to pass this with amendments. We're going to change the defective date to an effective date of upon approval. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For HB 613, Chair's recommendation is to pass this with amendments. We are going to insert, we're going to remove and insert HB 1101, which is essentially the same but it's part of the governor's package, into HB 613. We're also going to note in the committee report a general budget appropriation of $1,691,516 for fiscal year 26 and 27, and technical non-substantive amendments needed for clarity and consistency. Any comments, questions, concerns? Seeing none, pass with amendments.
Okay, with amendments, all 5 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for HB 1349, we removed 1349 from the agenda. Excuse me?
701 next.
Yeah, okay, we're getting there. Yes, we have removed 1349 from the agenda. From HB 701, relating to taxation, Chair's recommendation is to pass this with Executive Office of Aging's proposed amendments. We're going to change the defective date to December 31, 2050. Technical and add technical non-substantive amendments needed for clarity and consistency. We're going to note in the committee report the request of a $5,000 non-refundable credit with a fiscal implication of almost $400 million per annum. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, all 5 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 716, relating to health, Chair's recommendation is to pass this with amendments. We are going to just change the defective date to December 31, 2050. We're going to note in the committee report SHPTA's request of $20 to $25 million. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for HB 799, HD2, Chair's recommendation is to pass this with Department of Health's proposed amendments and a sunset date of 5 years from the effective date, which sunset date, and note in the committee report that the sunset date may be removed upon a favorable review of the Department of Health's report. Any comments, questions, concerns?
Sure.
Yes.
Thanks for those amendments and moving this along. I think, this is a very important bill. I think especially for Maui. I think, we've been working on this issue for the last 3 years, and I think if we didn't think progress was not being made, then I don't think we would need this bill, but I don't think progress is being made. That's the bottom line. So I think hopefully people who are working on this, especially the hospital, can start to figure this out, because the answer is not to send people to Oahu. We need to have some type of balance. I think safety is important, but we can't just stick with the status quo either. And so I appreciate you moving this forward, so at least that conversation can happen, the studies can happen, and we can make our healthcare continue even better. So thank you, Chair.
Okay, thank you very much. Pass with amendments. Vice Chair for the vote.
Okay, 5 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for HB 1179, Chair's recommendation is to pass this with technical non-substantive amendments needed for clarity and consistency with the Department of Human Services and Department of Health's proposed amendments and a different effective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 5 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for HB 951, Chair's recommendation is to pass this with Kaiser's proposed amendments and change the effective date to a effective date of upon approval. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 1120, Chair's recommendation is to pass this with Hawaii Reef Ocean Coalition's proposed amendments and an effective date of upon approval. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, Chair, we are on House Bill 1120.
Yes, relating to nuisances.
Okay. Okay, with amendments.
With
correct?
amendments.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 952 relating to Parkinson's disease research, we're going to pass this with amendments. We're going to amend the definition of department to State Health Planning and Development Agency. We're also going to add in an appropriation bank paragraph with a blank appropriation to SHPTA to implement this act and allow SHPTA to contract the services to an appropriate entity for such implementation. And technical non-substantive amendments need for clarity and consistency. Any comments, questions, concerns? Seeing none, pass with amendments HB 952. Vice Chair for the vote.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 1099, Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, voting on House Bill 1099, House Draft 1.
As is.
As is. All 5 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For HB 943, Chair's recommendation is to pass this with substantial amendments. We're going to remove Section 1. We're going to replace Section 2 with Department of Health's proposed Section 334, HRS Section 334 addition. We're going to replace the appropriation language with Department of Health's proposed language, except put in a blank appropriation and replace the phrase homeless triage and treatment program to the phrase that necessary to implement the act. Technical amendments as necessary for clarity and consistency. And we're going to note in the committee report the $5.9 million request. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, passed with amendments.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For HB 359 HD2, Chair's recommendation is to pass with amendments. We're going to add under 707-733, we're going to add a paragraph that 707-733 sub D offenders are applicable only if the offender is over the age of 24 years at the time of the offense. And we're going to note that it already has a defective date, so it goes to conference. Any comments, questions, concerns? Seeing none. Vice Chair for the vote, passed with amendments.
Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
And we are adjourned for the 1 o'clock calendar, but members, be around for the joint calendar. Thank you. Adjourned. Calling the Department of Health and Human Services and Committee on Water Land joint calendar for the 115 calendar. First up, HB 969 relating to waste or disposal facilities. Oh, present with me are my co-chair, Senator Inoue, my vice chair, Senator Aquino, Senator Hashimoto for Health and Human Services, and also Senator Chan from Water Land, Senator Keo'olole for Health and Human Services, Senator McKelvey from Water Land, Senator DeCourt from Water Land, and Senator Favela from Health and Human Services. First up, HB 969 relating to waste or disposal facilities. First up, Leanna Lay, Office of Hawaiian Affairs, in support. Raj Babcock, City and County of Honolulu, providing comments. Raj Please come on up.
Good afternoon, chairs, vice chairs, and committee members. Roger Babcock, Department of Environmental Services, City and County of Honolulu. We have submitted comments, written comments, describing the challenges of this bill for us, citing our next landfill that the island needs. But I also want to point out a new concern, and that has to do with the definition of a waste disposal facility. I noticed in the HD2 that there was something to clarify that a redemption center was not a waste disposal facility. However, we operate 7 convenience centers for folks to drop off waste of all different types, recycled materials, bulky items, and just rubbish as well. These are also, we collect recycled materials there. It's not clear whether these facilities are covered. We do have, we are modifying, expanding, and upgrading several of these facilities now. And so it's not clear to us whether or not this is a problem. We do currently have upgrade projects at Kawailoa, Waianae, Waimanalo, Ewa, and Waipahu, and several of these are above the aquifer. Thank you.
Thank you very much. Thank you. Ernest Lau, Board of Water Supply and Support.
Strong support.
Thank you very much. Anthony Paris of Makakilo Kapolei Honoka, Ihale Neighborhood Board Number 34, providing comments. Allison Fraley, County of Kauai Solid Waste Division, in opposition. Ryan Toyomura Mihoko Ito of WeWorld, providing comments. Come on up.
Good afternoon, chairs, vice chairs, members of the committee. Ryan Toyomura on behalf of WeWorld. WeWorld is the operator of the HPAR facility here in Honolulu. We don't have any, we have no position on the underlying bill other than to request the committee reject any of the proposed amendments related to the ash prohibition and ash reuse amendments that were proposed in some of the testimonies here. So other than that, that's it. Thank you.
Thank you very much. Prince Kuhio Hawaiian Civic Club, providing comments. John and Rita Shockley, Free Access Coalition, in support. Mike Ewell, Energy Justice Network, in support. Mike Ewell, are you present on Zoom? Please proceed, Mike Ewell.
Yes, I am, Chair. Yes, I am. Thank you. We urge you to amend House Bill 969 just as you have strengthened Senate Bills 446 and 438 by prohibiting the use of toxic incinerator ash in roads, construction, or as daily landfill cover. We support the Board of Water Supply's justified concern about both the landfill over the aquifer as well as spreading ash in the form of roads over the aquifer. If it's too dangerous to have the same ash in a double-lined landfill over the aquifer, it's surely too dangerous to be putting in roads all over the aquifer with no liner systems. There are a lot of misconceptions about this bill, or about the ash issue. For example, Roger Babcock has been referring to it as if it's just sand, which is chemically inaccurate and not true. They've talked about as if it's safe and inert when EPA has specified that their test saying it's non-hazardous does not mean that. And there are just a lot of other misconceptions I'm happy to address. If there are any questions, I'm available for questions, and mahalo.
Thank you very much. Melody Aduha, Environmental Caucus of Democratic Party of Hawaii, in support. Maka'ala Kaumoana, Hanalei Watershed Hui, in support. Danielle Nellis of Dole Food Company, in support. Danielle, are you present on Zoom?
Yes.
Please proceed.
Yeah, I'm the chair, thank you, and to your committee, thank you. I'm the general manager of Dole Food Company of Hawaii, and we are in strong support of this bill, and any protection of the aquifer is very important to us, as well as we don't agree with having landfills sited on agricultural land. So strong support. Thank you.
Okay, thank you very much. Henry Curtis, Life of the Land, in support. Susan Emery, Green Party of Hawaii, in support. Wayne Tanaka, Sierra Club of Hawaii, in support. Wayne Tanaka.
We'll send our testimony to Johnson.
Thank you very much. Ted Boland, Hawaii Reef and Ocean Coalition, in support.
Stand on written testimony in support.
Thank you very much. Carol Phillips, North Shore Chamber of Commerce, in support. Tika Bukowski, IBEW, in support. Tika, are you present? No? Okay, Brian Miyamoto, Hawaii Farm Bureau, in support. Larry Meacham, in support.
Thank you for the opportunity to testify. Just 4 points.
Identify yourself.
I'm sorry, I'm Larry Meacham, Wahiwa resident. This is not a Wahiwa and NIMBY complaint. It's actually our neighbors in Waialua and Haleiwa who will be affected by this. And number two, we had a town hall meeting on this. 250 very angry people showed up. Number three, as one of those people said, we should not take no for an answer from the military. We should look at Kalailoa and other places that are not over the aquifer. Number four, when it leaks, and it will leak eventually, it'll be worse than Red Hill because it won't be a one-time thing. It'll be a continuous leak into the aquifer. Thank you.
Okay, thank you very much. Next, we have Carol Phillips. No, we did that. Okay. No one else having registered to testify except for Dwayne Bautista. Dwayne, are you present? Come on up. Identify yourself.
He got taller, handsome. Good afternoon, chairs, madam chairs, and co-chairs, and committee members. My name is Cliff LeBoy. I'm with the Ironworkers Stabilization Fund. I have two groups that I'm helping today. The other one is the Hawaii Building Construction Trade Council, which consists of 35,000 members, and we all are in strong support of House Bill 969.
Thank you very much.
I will pass the message on to Dwayne.
Okay,
guys
thank
have
you
a good
very
day.
much. Next, we have Department of Health, Environmental Health Administration providing comments. Are you present? Okay, please proceed.
Good afternoon, chairs, vice chairs, and committee members. Glenn Howell on behalf of the Department of Health. The department apologizes for the late submittal of our written testimony and would like to summarize our testimony offering comments. We note the use of the term significant aquifer is problematic since interpretations of significant are subjective. We recommend discarding this term and have provided other options. However, if the intent is to continue use of this term, we require further clarification with criteria from the legislature. Another option to consider is deferring the measure. Since county governments are responsible for providing waste management and water resources to their counties, each county can develop additional landfill siting restrictions through their own county ordinances. If the legislature elects to have a restriction at the state level and intends to prohibit landfills above potential drinking water sources, we provided an option with language for use of a no-pass zone, which identifies the area where placing a waste disposal facility may contaminate potential drinking water sources. Each county would be able to determine these areas for themselves and establish this zone via inclusion in their integrated solid waste management plans. Note that is, at this time, only the City and County of Honolulu's Board of Water Supply has developed a no-pass zone. Other counties would need additional time and appropriations for development and establishment. And another option for a state-level restriction is use of the state's underground injection control or UIC line. Areas marked off this line identify potential drinking water
Thank you
sources.
very much.
Thank you.
Okay. No one else having registered to testify. There is about 50 individuals all providing written testimony in support and one in opposition. Anybody else wishing to testify on HB 969? Members, any questions? So I just have a question. Roger Babcock, come on in. You wanted to redefine waste disposal site, but your testimony doesn't have a new definition of waste disposal site.
Yeah, that's correct. We didn't provide a suggestion.
Okay.
Yeah.
That's what I thought.
Okay.
Thank you very much. Any other questions? Yes.
I have a question for you.
For him, okay.
So I understand you guys having a hard time to find places, and I know you guys remodeling the treatment plant. But in my community, you guys using it for a temporary dump site in Mahiko Park, right next to a park, the Parks and Rec. So I brought this up to the mayor, and I'll bring this up to you too. It's not acceptable because there's no place to put them in a timely manner, putting rubbish in the historical Eva Beach area. And everybody likes to suggest to put them in Kalailoa, all these areas, and dumping rubbish in our areas. I don't think that's a good idea. We're a congested area with plenty of community members and park users. So if you can take that back, that is not acceptable that they're dumping rubbish on a historical site at Mahiko Park. You guys have enough room on top of you guys' treatment plant to figure out one place to store or station trash, not in the Mexico Park area. Thank you,
Okay,
Chair.
thank you very much. Okay, Senator Court, to whom?
Quick question, for Roger,
Mr.
yes,
Babcock.
please, thank you. It was suggested that the YPO soccer complex might have been a potential site, however, the Navy is occupying that. What is the reality that could be used?
Yeah, thanks for the question. So that site meets all of the legal restrictions. So it's not in a tsunami inundation zone. It's not near an airport. It's also not over any aquifer that's potable. And it meets all other restrictions, including half-mile buffer distance to residences and schools and all that kind of stuff. The only restriction is that it's federal land, and it was requested by the administration, but it was turned down as a possibility.
Okay, so that's not even an option.
So as far as we know, it's off the table.
Okay, thank you very much. Thank you, Chair.
Any other questions? Senator McKelvey?
Follow-up.
For him?
Yeah, for him, real quickly, you
Roger.
better double check on that because it sounds like this new administration is completely taking a 180 on this. So please do that.
Okay, thank you very much.
Thank you.
Any other questions? Seeing none, may we move ahead with decision-making? Okay, so for Health Human Services, Chair's recommendation is to pass this just with a different effective date of December 31, 2050. We know Department of Health concerns, but the other counties have no determination as to that no pass zone, so we're not gonna put that in for the amendment. Any other and regarding the fly ash that we had in the Senate bill, we're gonna note that witnesses have come forward saying that it should be done on a case-by-case basis, so we're gonna note that in the committee report that it is a concern, but it should be done on a case-by-case basis. But otherwise, pass with amendments just with a different effective date. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, voting on House Bill 969, House Draft 2, recommendation of the Chair to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto? Aye. Senator Keokalole? Aye. Senator Favela?
Aye.
Recommendation is adopted, Chair.
Thank you. For the Committee on Water and Land, Chair's recommendation to pass HB 969 House Draft 2 with amendments. Any discussions? Water and Land Committee, Vice Chair or Senator Chang for the vote. Chair goes aye.
Chair votes aye. Vice Chair Alfante?
Aye.
Senator Chang, aye. Senator McKelvey?
Yes.
Senator DeCourt?
No.
Recommendation is adopted.
Thank you.
Okay, and with that, we are adjourned. Thank you, folks.